Okay, moving right along. Achondroplasia is the most common form of dwarfism. It is a single trait disorder that occurs as a result of a mutation in a gene that codes for fibroblast growth factor receptor. Um, I'll explain how that works in a minute. It's a little complicated, but you'll get it. It's an FGFR3 gene. It's transmitted through autosomal dominance, but most of the time it comes from a de novo spontaneous first ever mutation. Now, once it happens, it's in every cell in the person's body, and they will transmit it to their offspring. But that is the pattern. So, the protein product of FGFR3, fibroblast growth factor, um, is important in growing bone and brain tissue. In achondroplasia, it really seems to impact bones. So, this mutated protein, now, when we have this mutation, it's an aggressively active receptor for fibroblast growth. Fibroblasts like break down fibers, so it shortens the long bone growth during embryonic and fetal life, and they never really catch up from that. Now, remember we said with the other disorders, it could be any one of many different types of mutations. There are really only 2-point mutations that cause about 99% of this disorder. And what happens is in this mutated protein, we have an arginine amino acid instead of a glycine. It's just really to show you like how important it is for everything in genetics to go exactly the way it was programmed to go. So the de novo mutations that are common causes of this disorder are linked to advanced paternal age, interestingly enough. Okay, signs and symptoms. Intellectual potential not really affected unless there's hydrocephalus and it's not treated. But in general, the intelligence ranges are the same as general population. A slightly larger head size with a bigger forehead, that is called frontal bossing. A normal sized torso. The long bones of the femur and the humerus are short. There can be creased skin or extra skin in the extremities, a very short neck with an abnormal junction to the head at that bone, the atlas. And this becomes important when we talk about sleep apnea and SIDS. Sleep apnea is a consequence of that abnormal sort of fusion. There is a high incidence of sudden infant death syndrome for that reason, because the neck is very short, the trachea can be obstructed very easily. A large prominent face. There are delays in motor development, and most people do catch up. Um, a lot of that is due to other skeletal problems like scoliosis. There is short stature, of course. Lordosis is an abnormal curvature, that S part of the spine. There can be crowded teeth with poor bite. Can all be fixed. Hydrocephalus complicates maybe about 20% of the newborns that have it, but not all individuals have it. So how do we treat achondroplasia? How do we diagnose it? Is pretty easy. I mean, it's very apparent. You usually diagnose it on ultrasound. And then if not, you can see it in the newborn period very easily just by the appearance of the bones. How do we treat it? Correcting things that we can. It's all targeted at symptoms that would impact that person's function. Correction of scoliosis could be a big one. That actually helps with breathing. Correction of kyphosis. Kyphosis is an abnormal curve in the thoracic region of the spine. There have been some reports of leg lengthening, but it's very controversial. The idea would be to give that person a few inches of height. It's painful and invasive. And, the risk versus benefit there, does it give them a little bit of function more? Maybe, but there might be better ways to help adapt the environment so that individuals don't have to go through a painful procedure. Surgical correction of hydrocephalus, if it's present in the newborn, and you would do a ventroperitoneal shunt outside the scope of this class, but you would want to drain that fluid. Physical and occupational therapy. If both parents have achondroplasia, Pre-implantation genetic diagnosis can eliminate the risk of perinatal loss. So it's an autosomal dominant trait, and most of the time the pattern you get is heterozygous dominant. If you are homozygous, chances are that's a loss. That's an embryo that is not going to develop. It's pretty lethal. Every so often there are case reports of stillbirth at later gestational ages, but it's pretty lethal. If they have obstructive sleep apnea, treat that. If they need decompression of the cervical spine because of the fusion, that's an option. Ear infections, there's a difference in the shape of the eustachian tubes because of the way that the face and head are shaped. So you would want to treat ear infections a little more aggressively to prevent hearing loss. Resources, lots of resources for people with achondroplasia, and you definitely want to help families access these. These are people who can live very happy, productive lives, get married, have children, have successful careers. I think the key is to give people the support they need to support their children. Magic Foundation, Little People of America, Chandler Project, Growing Stronger, Human Growth Foundation. If you have interest in any of those organizations, I encourage you to look them up. They have some excellent stuff for people. We are going to take a break here and move on to complex polygenic disorders next, and that will be our last lecture in this series.